Hello, Medicare Adventurers! Welcome back. My name is Chris Tucker, your Medicare guide and Medicare agent. And today we are going to start going over in depth all of the different parts of Medicare. Now, in a previous segment, we had already discussed all the different parts such as A and the B and C's and so on and so forth, but we didn't really dive deep. We went over some of their basic differences and their coverages, but these segments will go much deeper into cost sharing and different features like that. So let's drop in. Part A, which is our first one we're going to start with, is the easiest one. For many seniors, individuals who qualify for Medicare, Part A is something they're not going to be paying for at all. There is no Part A premium. Other than in few cases, such as with those who are foreign who come in and do not have enough work quarters or credits associated with their benefits. But Part A goes over a couple of different things, and I have a paper here to be able to make sure I'm guiding us correctly in our journey today. So with Part A, it covers inpatient care in a hospital, skilled nursing facility care, nursing home care, hospice care, and home health care. Now, notice it says care a lot because Part A is your doctor stuff. Okay? Part A is the portion of it that doesn't deal with the facilities or your actual hospital stay. It deals with the nurses and the practitioners who are taking care of you. Okay? Now, there are two ways to find out if Medicare covers what you need. First, you can speak to your healthcare provider. They would be able to tell you whether or not a service or procedure that they offer is covered under Medicare. Or second, you can go on to Medicare.gov. Again, that is Medicare.gov, and you would be able to look up the different services that are covered under Medicare on the government website. Also, Medicare coverage is based upon three main factors, something I have to read as we go over this. One is federal and state laws. Remember, with both Medicare Part A and B, which is also called Original Medicare, we are dealing with the coverage that the government has set up. And so, federal and state laws would apply to the coverage that Part A has. Number two, national coverage decisions made by Medicare about whether something is covered. Again, going back to the federal and state laws. And then number three, local coverage decisions made by companies in each state that process claims for Medicare. These companies decide whether something is medically necessary and should be covered in their area. And this would apply more on some of the latter letters we're going to talk about, such as the C and the D and the F and the G and the N, so on and so forth. But for Part A, if you are just on Original Medicare, speaking on the Part A, if all you had were your Medicare card and you went into a hospital and you provided that card, the providers, such as the nurses and the doctors, their care would be covered under that Part A portion. And before they provide any services to you, they are required and are supposed to let you know whether or not those processes and procedures are covered under that Part A umbrella of Medicare. So today we've gone much more in depth on that Part A. Again, it's the part of Original Medicare that does not have a premium associated with it, and it covers in particular doctors and nurses' services and procedures that they offer. So, if you have any further questions, please do not hesitate to reach out to me. My contact information is below in the description, as well as on my Facebook page. Please be sure to like, comment, subscribe, share with your friends, family, neighbors, and community. I hope that these are a blessing to make this system of Medicare that sometimes can feel very convoluted and as dense as jungle foliage, a little simpler and easier to understand. Again, my name is Chris Tucker, your Medicare guide, and I look forward to hearing from you with any further questions that you have. And I'm also looking forward to guiding you on further adventures.